We are discussing some very important topics, especially high blood pressure, that is hypertension. In a lot of persons, high blood pressure is a very difficult problem to treat, requiring multiple antihypertensive medications, and some of them have high blood pressure or hypertension from a very young age. They have other symptoms like palpitations, sweating, headache. Some have also weakness, lethargy. So in all these cases, an important aspect of hypertension diagnosis is looking for secondary causes of hypertension, because why we need to look at it is because they are reversible and they may be curable if they are detected and treated early, and especially if they are also not detected in a timely way, then also they are associated with increased risk of complications, which can be sometimes very dangerous. So like in pheochromocytoma, which is though not a very common cause, but still a very important cause of hypertension, there patients can present with a palpitation, headache, sweating, sudden rise of blood pressure, even myocardial infarction, stroke, heart failure also. They can present with heart failure. They can present with an adrenal mass as well. So picking them up early is very important, diagnosing them early, especially with adrenal mass. This can be a differential diagnosis of hyperaldosteronism, where again this is a very important, more common cause of hypertension, where the patients present with hypertension with low potassium, weakness as well. So we need to do some hormonal workups initially, like measuring the hormonal levels and their metabolites like catecholamines, like metanephrines in urine or plasma, or aldosterone plasma renin activity, to rule out pheochromocytoma and hyperaldosteronism respectively. And once the biochemical diagnosis is established, then one need to look into the imaging or radiological aspect to know where exactly the culprit lesion is. And so most commonly we do a CT scan of the abdomen and pelvis and retroperitoneum to look for an adrenal mass for pheochromocytoma. And then we sometimes need functional imaging like PET scans if we have some diagnostic dilemma, and then we can actually look into the whatever damages that has also caused. Very importantly, this may also be an important cause of secondary diabetes as well, both pheochromocytoma as well as hyperaldosteronism. So this is not only a cause of hypertension but also a cause of secondary diabetes. And most of the time there are tumors harboring which are there in the adrenal gland or rarely in other places, and a timely diagnosis can actually reverse the hypertension as well. Not only that, that can be associated with fatal complications which can be dangerous, and especially if they undergo any other surgery undetected, that can be also fatal. So picking them up early, especially in patients who have a young early onset hypertension, uncontrolled hypertension, very labile hypertension and fluctuating hypertension, if they have an adrenal mass with hypertension, so or a family history of hypertension and early onset of hypertension, or family history of any of the diseases, one should be very careful, and one need to have an eye to diagnose these early, to reverse hypertension as well as to prevent the fatal complications. So we need to raise awareness and make the public as well as the physicians aware of these treatable conditions. Thank you very much.